So we're back again, and we have our good friend, Dr. Michael Misalek. Let me just give you a little introduction about who this person is. You attended one of our galas this week, which was for Peter Latos, who died from prostate cancer, and I hope you had a good time that night.
Absolutely.
And I also had the pleasure of meeting your wife. This was about 500 people came, and I was talking about prostate cancer. Dr. Misalek has been, I've known you for a few months, but you've been so instrumental in really teaching us about, the pathology's role, the fact that they should not be behind microscope. And if you have any questions for Michael, call 877-970-2999, and he will take live questions. He's the Associate Chair of Pathology at Newton Wellesley Hospital, and he's a medical director of Vernon Cancer Center, and he's been involved in chemistry lab, a lot of research, and a huge advocate for pathologists to go out there and educate people about the second opinion and role of second opinion. Michael, welcome to the show.
Thank you very much,
We're so happy
David.
to have you here.
Thank you.
I know you've been working on a lot of programs with prostate cancer. A lot of people who are diagnosed with prostate cancer, they get a report that says your Gleason score is 6 or 7. What in the world is Gleason score?
Okay, well, that's one of the most important questions, as you know, about prostate cancer, and one that you as a urologist will ask, and any other doctor who first treats a patient with prostate cancer is to request that pathology report. We know that all treatment begins with a diagnosis, and one of my passions is to advocate and raise awareness of who actually makes that diagnosis, and it's the pathologist who for many years has been behind the scenes working with their microscope down in the lab, but it's now time for us to come out from behind the microscopes, out from the lab, introduce ourselves to patients, to our clinical colleagues, and really have them recognize the role and the value that pathology brings to the healthcare team. For Gleason specifically, now Gleason score is a grading system that pathologists use to give an estimate of what we predict to be the aggressiveness of a tumor, and it gives a lot of information about that patient's prognosis and treatment options that you know as a urologist will guide you in your treatment of that patient.
It's interesting that you say this, because I've had patients who tell me, well, who are my pathologists? What is the credential that they have? Should everybody be reading these slides, or is there a special training for prostate cancer? And my answer is that at least at Lenox Hill, we have a uropathologist who's concentrated on prostate cancer, and she's well known, and I do over 500 of these cases. So she is basically seeing these slides coming in at a very fast speed, and the more you do, the better it is. The skill of pathologists, how important is that?
Absolutely. That you hit it right on the head. Just like surgery, when experience matters, well, in pathology, experience matters as well. And one of the first questions as a patient you should ask of your doctor is your pathologist board certified? The College of American Pathologists certifies pathologists who have reached the highest level of expertise, diagnostic skills, and it's with that credentialing you can be assured you're going to get a reliable diagnosis. But I would also venture to go one step further. Ask if your laboratory that the pathology material is being produced in is also accredited by the College of American Pathology.